or to know that you might be surrounded by somebody who has this, and they may not necessarily be sick. They may not be at home, and that's why folks are saying keep an eye out for it. So how does it spread? That's the key.
Yeah, that was my next question to you.
So classically, norovirus has been seen as something that we often see on cruise ships, on sort of closed environments where a lot of people are in close contact with each other. Now what we're seeing is maybe kids who might have picked it up through daycare, then they bring it home. And so it can really rip through a household, especially if folks are in close quarters. So, but what about the real spread? How is it spread? So it's considered to spread from what we call the fecal-oral route. That means anything that comes from your intestinal tract, whether it's from the bottom or from the top, even from vomiting, and you can have aerosolized particles from that as well. Or if you have close contact with viral particles from a doorknob, from a countertop, these can all be sources for you to get affected. So that's the main thing. So when you look at this norovirus, one of the things that people are wondering is, why is it so strong? We've had it for so many years, but why is it strong this year? So norovirus in general, it's actually a very hardy virus. It has a hard protein shell, and that's very resistant to extreme temperatures. So you might clean a countertop, but it might not necessarily do anything. You might also, like even if you use alcohol-based hand sanitizers, that may not be as effective for norovirus. And so most of your disinfectants, even if you use bleach, you should try to use a very significant disinfectant like bleach that can actually be fairly effective for norovirus.
Lysol would not be effective for norovirus.
So Lysol, there are some Lysols. I know they have Lysol with bleach.
Yeah.
But bleach is considered one of the better, stronger ones for it.
Okay.
But the hand sanitizers that we've all grown to know and love over these past couple of years, that's not considered a great agent for it. So what do you need to do? You need to basically do what we always talk about. Washing your hands really well with soap. Try to get that, if you can get that time in, hand hygiene whenever you're leaving the restroom, whenever you're touching the surface, the door. So those are all things that you can try to do to avoid getting in contact, not just with norovirus, but also a lot of these others, right? Those are just good safety habits. Also, food safety is definitely something that's good. It's best to avoid finger foods, maybe sharing snacks, things like that, in this time. Now, even if someone is isolated, as I said, that isolation period is not the key thing. It's also the 2 weeks afterwards. So someone may have been sick even 2 weeks ago, and they're walking around, they may be a source. So you definitely need to keep an eye out for that. One of the things that folks are also saying is, what about personal protective equipment? These are things that were somewhat controversial for folks during COVID, but using that type of stuff can be helpful. If you're on that side, I rely more on the hand washing, because that's probably the easiest way to have this sort of transmission route interrupted. So what do you do if you get norovirus? In general, what do you do if you get any stomach flu? It's basically rehydration. You're going to be losing a lot of liquids, so making sure you're taking in electrolytes, things like your Gatorades, your Powerades, those are all great. Some folks might take anti-emetic agents, like anti-nausea medications. You can always try to use that, but you got to soldier through that 2-day period. That
Pedialyte would be the same thing, Doc?
Exactly. Pedialyte is also something that ideally, if you can, you should try to down that, every so often. Some folks say you should take at least 1 small ounce cup every 5 to 15 minutes if you can keep it down, right? Because you got to keep it down, because you might also throw that up. So just another thing to be worried about. So we're going to take a break here on the Hackers and go in a little bit different direction.
You're listening to The Medical Hackers with Dr. Sandeep Rao, board-certified vascular interventionalist, bringing you insights on treatments for common medical problems on News Radio 690 KTSM. For more information on the issues being discussed or to contact Dr. Rao, call 915-500-4370 or by emailing rao@medicalhackers.com.
Vascular Hackers, Dr. Rao here with Uni. And one of the topics that I talk about from a variety of different angles is cancer. There's so many different types of cancer out there. Last week, I believe we talked about prostate cancer. This week, I wanted to talk a little bit about thyroid cancer. So the thyroid gland is a gland that sort of sits right there in your neck. You know, if you can, most people can actually feel your thyroid. So when you go to a doctor, sometimes they'll come up and they'll palpate, they'll put pressure on the neck, kind of underneath that Adam's apple area here.
And what is the reason they're palpating the thyroid, Doc?
What they're palpating for is they're trying to assess, in a general sense, the size of it. Sometimes you can feel if it's way bigger. But more specifically, they're also looking for possible nodules. A nodule can be anything. A nodule is basically a small area that's growing maybe a little bit faster and abnormally than any other part of that thyroid gland. And that's what I wanted to get into, because we are seeing increasing diagnoses of thyroid cancer. So when you see and you look back, let's say you look at 1975, okay? That's, almost 40 years ago. There's for every 100,000 people, we found about 5 cases of thyroid cancer. Now, that's actually changed when you look at what we saw. There's a recent thing looking at about 2009, okay? So that's over, over a 30-year period. That same 100,000 patient population, whereas previously we'd find 5 cases of thyroid cancer, now we're diagnosing 15 cases of thyroid cancer.
That's pretty significant.
No, so it is significant. The question is,